Hi everyone, welcome back to my channel. I'm Sylvia. If you're new, welcome. If you're interested in content like this, please make sure you subscribe. Today I'm heading out to my med spa and get a BBL treatment done. So this is the second out of a series of 3, and I wanted to take you along my way and show you the results. So a BBL, it's not a laser treatment. It's more like a pulse light therapy. I've had IPL treatments done in the past. Maybe you have too. When I was, and this was when I was living back in Texas, maybe 15 years ago or so. And my esthetician has mentioned before that BBL is the newer version of IPL. So it's similar to IPL, but it's a little bit more advanced. So what BBL does, and I will let my esthetician talk a little bit more about this when I'm seeing her, it reduces freckles, age spots, brown spots, broken capillaries, melasma, and other skin concerns. And the reason why I decided to do this is because when I was filming my videos in the past, I noticed that I have brown spots around my eyes that are very apparent. Maybe you have noticed them too when you were watching my videos. And I talked to my esthetician and she said, yeah, we could try BBL. And I bought a series of 3, so you should see results after the first treatment already. But the more you do, the better. So they're not cheap, but they're not super expensive like Fraxel, for example. So I bought my series of 3 for under $1,000. And the reason why I got it at that price is because I'm a member of this med spa. So I'm going to mention it by name right now. It's called Elace. And Elace has spa locations in across Utah. So I think they're only in Utah. Maybe there's one in Idaho as well. If you happen to live in Utah, make sure you check them out. They're really great. Their staff is super friendly. I really like them a lot. Their their facilities are super nice, elevated, very classy looking, white, and it feels like deluxe, right? And the treatments are great, and the staff that perform the treatments, they're super competent, also very friendly. I'm just very, very happy with that spa, and I became a member. So you can become a member and they have different tiers. I don't know right now what tier I am, but they take out $149 out of my account every month, and it accumulates in my account, and I can then use the balance for treatments. Plus, I get great discounts on stuff. So I think for the BBL treatment, I want to say I got 20% off. So this is a really great deal. If you happen to live in Utah or in southern Idaho, you may want to check them out and give them a try, because I can really recommend them. They're great. Elace, that's what the company is called. But even in other states, they may have similar spas where you can become a member and get special discounts. So that's what I'm going to do today. I will film during the treatment if she lets me, but she usually does. She's super nice. And I will also film more footage in the following days just to see. So you usually get a lot of brown spots after the treatment that will then come off. They will slough off, right? So, and then you have better looking skin afterwards. So that's what I'm going to do today. I will film at my Elace location, and make sure you check it out. See you later. Bye. So this is the machine for the BBL treatment, and maybe you can tell us a little bit about what BBL is and how it works, what it's good for.
So BBL stands for BroadBand Light. It's a laser treatment that uses different wavelengths to target pigmentation, redness, collagen, elastin, acne. Kind of treats a little bit of everything. Main purpose is for pigmentation and anti-aging. It's aggressive without a super bad downtime. You'll have some pigmentation pull up to the surface, kind of scab up, and then fall away, leaving your skin and your complexion very smooth, very tight, very firm. It's one of the top treatments in the industry right now for anti-aging and pigmentation. So that's BBL.
So how does it compare to IPL?
Very similar, there's more wavelengths, so you can treat more layers of the skin, different types of pigments. IPL stands for Intense Pulse Light, BBL is Broadband Light, so it's just different wavelengths targeting more things than we used to do.
Great. And how many treatments would be ideal for someone?
Yes, we recommend a minimum of 3, but depending on the skin concerns and the reaction that your skin has, can be anywhere up to 6. And we recommend a maintenance of 1 per year after year 3.
Great, thank you.
Okay, I'm going to take off your numbing cream. Perfect. Almost under your eyes. That looks so good.
Yeah, it's still a little discolored.
Yeah.
It's still my problem area.
Because you've been doing the PRF too, right, under there?
Yeah,
How have you been liking that?
I like that a lot. So I did a lot for my under eye bags. They're almost completely gone.
Yeah.
So that made a huge difference for sure.
Now we're just kind of getting more of the pigment. I love it. And your first treatment, do you feel like you had a lot of like pigment pulled to the surface? Not a ton?
Not a ton.
Okay.
I feel like when you did like the spot treatment that one time to give me an idea, I felt like it was more.
Okay.
I don't know why.
No, that's okay. I mean, it was a smaller area, so I feel like, and that's where you had a lot of it, so that's probably why.
Yeah.
I mean, you don't have tons of really bad pigment all over, but I do see a couple little spots too that we can maybe go a little more aggressive on today. And pain-wise, how was it for you? Was it?
Yeah, it wasn't bad.
Wasn't bad. Okay,
no.
good. That's what we like to hear.
So the numbing cream was on for a little over maybe 16 minutes or so.
Yeah.
I feel my lips are really numb.
Yeah. I feel like this, I mean, especially for the BBL, you really don't need it on super long because we're doing more like superficials where it's going to help the most.
Yes.
I feel like BBL, you kind of feel it no matter what a little bit. It just kind of takes the edge off.
Yeah.
So I don't feel like you really need it. And it kind of hits its peak at about 10 minutes. Not its peak, but it starts to really kick in at about 10 minutes. So it should hopefully be where we want it to be. If it's ever feeling too intense or you need a break, let me know and we can adjust it. But hopefully should be enough for you.
Okay. Because I won't see anything with those goggles.
If we put the goggles on, we're not seeing anything.
Yeah.
And I can kind of keep an eye on it and move it if needs be.
Great.
And if you lift your head really quick.
Yeah, I'm just gonna record a little bit. Is it recording? Can you see the?
Yep.
Okay.
Yeah, it's recording, so you're good. How do those goggles feel?
They're good. Yeah.
Perfect. Alrighty, well, you ready to get started?
I'm ready.
Okay, I'm gonna put a little bit of gel on you. I can get it out. Come on. There we go. Perfect. And it feels a little snappy, kind of has that little snap with a little bit of heat. So again, if anything's feeling too ouchy, let me know.
Yeah, I didn't. The girl who treated me last time, she made it sound like it was gonna be really bad and painful.
Yeah.
So I was expecting the worst, and I mean, it's better that way than the other way around, right?
Totally, I'm with you on that. I'm like, I'd rather expect worse and have it be better.
Yeah.
Than have it be terrible and expect it to not be too bad. Okay. Let me just put in my settings. Alrighty. So maybe tilt maybe a little bit more to the left. Perfect. Camera's on it, so it looks good.
Good.
So I'm gonna do one little pulse just to kind of remind you how it feels, and then we'll go a little quicker, okay?
Yeah.
How's that?
Good.
Okay.
So do you go over the area only once, or are there multiple?
So we'll go over it a couple times. So this first thing that we're doing right now is what we call our base pass. So this just kind of helps prep the skin, kind of pull that pigment that's kind of deeper beneath the surface, closer up to the surface. It kind of just kind of helps get the skin ready. And then, so we go over this a couple times, this cheek a couple times. And then we'll go in and kind of spot treat with a little bit of a smaller tip to kind of spot treat any stubborn spots that maybe aren't pulling still. Could use a little extra love. those kind of things. And then you have like a little bit of redness, like some veins and some vascular stuff, so we'll maybe spot treat those a little bit too.
Okay.
Just to kind of help reduce some of those like veins and things. You don't have tons, but
yeah,
it'll help us kind of get whatever is there.
Right.
And then that's really it. So we go over each area a couple times. In the grand scheme of things, it kind of ends up being a little bit more, but hopefully not too awful. Still doing okay? We go over it probably like 2 more times. We go off of like a pulse count, so we try to do like 100 pulses on each cheek, and then like 150 on your upper lip and your chin, and then like 100 on each side of your forehead is kind of what we try to do.
It's a little warm. Just
A little warm.
to let people know what it feels like, but it's not bad. It's not bad at all.
Perfect. Okay, maybe tilt that up. You're good. Just stay relaxed. You don't have to pull tight or anything. Here we go. Still doing okay? Good. Done with that area. Gotta make sure that thing's going. I'm gonna put a little more gel on you. Move this a little bit. So good. So this will just help a lot with like your redness in your cheeks, kind of even out that skin tone a little bit more there too.
Hi, so I'm back from my treatment, as you can see. It wasn't bad at all. It really does not hurt very much. They put numbing cream on you and you can barely feel it. It feels a little warm. And right after the treatment, you definitely feel a little warm. I still do. And as you can see, there's quite a bit of redness and all these brown spots. You see that? So I know I look pretty bad, but so these brown spots, They will darken over the next few hours, and then they will start flaking off tomorrow, and it takes 2 to 3 days until, well, maybe 3 to 4. Let's say 4 days until you look normal again, just to be on the safe side. So, yep, it does look bad. There is a little bit of downtime for sure. They recommend not going out in the sun, not to exercise the day of your procedure. So I will definitely stay out of the sun for the next couple of days. And yeah, I will keep recording the process. I will check back in tomorrow and then the day after and so forth. And you can see the progression of this healing process here. See, I'm really dark here around the eyes. That's where I had most of the pigmentation. She did some spot treatments also for the red veins that I have on my nose and my cheeks. So I should see pretty good results. So stay tuned. I'll check in with you guys tomorrow. Hi guys, I just wanted to check in real quick. So today is day 2, the first day post-treatment. I had my BBL done yesterday, and this is what I look like today. So yes, I look pretty bad. As you can see, I have tons of brown spots. I don't know if you, yeah, all of these brown spots, they're gonna end up flaking off. But this is about as dark as it gets. So today I probably am gonna look my worst. And by tomorrow, the flaking should be in high swing. So I also have a little bit of swelling under my eyes, if you can see that right here. So she got me pretty good. Yeah, I look pretty bad. So I plan on spending another day at home. It's too bad I have a meeting coming up. I think I'm gonna tell them that my camera doesn't work. I really don't want my colleagues to see me like this. Yeah, so and I don't think this can be covered up with makeup. No, that's a little bit too dark. But yeah, this is as bad as it gets on the second day, 1 day post-treatment, and I will check in with you guys tomorrow. Hi guys, just wanted to check in. Today is the second day post BBL treatment. As you can see, I still look pretty bad, but I don't look worse than yesterday. Yesterday was literally the worst day. So I think it's starting to flake off a little bit, the brown spots, and it's going to get increasingly better from today on, maybe a few more days until I'm back to normal. So I have not left my house looking like this because it's pretty intense. I am supposed to run a 5K tomorrow. I'm still undecided whether I should go or not. Yeah, we'll see. As you can see, there's no more swelling, but there's definitely still a lot of brown here all over my face, a little bit on my nose, my chin. I have one spot here on my forehead and over here, as you can see. So yeah, it's a little bit invasive. I mean, you will have some downtime if you have it done right, but the results are gonna be so good. So I'll check in with you guys tomorrow. So today, again, it's the second day post BBL treatment. Guys, I'm back, and today is day 3. So 3 days since my BBL treatment. As you can see, I still have brown spots, but it is starting to look better. In fact, I'm not sure if you can see this on my camera. It is definitely starting to flake off, those brown spots. And I did go run my 5K this morning, so I didn't mind. I don't know if people looked at me like I was weird or something, but I did go out in public today, but now I'm going to spend the rest of the day at home. So if you plan on having a treatment like this done, you should definitely count on having 3 to 4 days of downtime. It will start looking better and better now, and I'll be able to cover this up with makeup very soon. But yeah, if you have it done right, like I've said before, like my lady did, thank you very much if you're watching this. Yeah, it's gonna look a little rough for a few days, but I'm feeling great. It's just the brown spots that need to go away. So I will finish editing this video today and we'll upload it. But I know I'm not done completely, so you won't be able to see the final results in this video. So I will make a short that I will upload next week once I'm done. So you can see the finished results. Okay, so thank you so much for watching. I hope you're having a wonderful weekend. Bye.